Well, thank you very much, and we've certainly had a very rich morning of presentations and a really remarkable focus on an important problem, a framework for action to respond, and a complex set of issues that have been dealt with by this commission in a remarkably short period of time with a clarity of vision and a specificity of findings and recommendations that I think really gives us an enormous opportunity to now make a difference. We are a little behind schedule, so I think what is key now is to have the opportunity for all of you to engage with us in questions and answers and discussions. And I know that there also will be some questions from individuals who have been listening on the webcast. I think what's striking as we listen to this rolling out of the report and its findings and recommendations, that there are few problems more timely or more important, yet we have been here before in terms of the recognition of the seriousness of the problem, the neglected dimension of global security, the fact that infectious diseases and pandemics threaten us all. Even if a disease occurs in a remote part of the world, it can be in our backyard tomorrow, and we are all interconnected in so many crucial ways. We recognize the human costs, the economic costs, the enormous disruptions to society and life as we know it, the undermining of confidence in government and other critical institutions, and importantly, the serious threat to national and global security. There have been many calls to action. We have experienced, even over the past years and decades, a series of very momentous and profound disease outbreaks of international concern. There have been many reports and recommendations, yet we have not made the progress that we need to make. I guess as I think about the framing for this important period of question and answer and the ongoing discussion about this report and its implementation, the need to really focus on how will we make this real? How will we really translate a very important vision and framework for action that tees it up for greater understanding, awareness, and action by policymakers with the support of the public? But how will we really make it different this time in terms of a meaningful and enduring difference? And I'd like to take the prerogative of being the moderator of this session by asking the first question, and I see a few hands going up for questions as well. But I think one of the things that stands out, as we've seen a couple of other reports emerging in response to the recent Ebola crisis, and as there's been much discussion about what happened and why and how we could do better. Concerns about the role of WHO. The report notes that there were clear deficiencies in leadership and governance by WHO, yet the report also does make a series of recommendations giving WHO new responsibilities, of course, along with some new resources as well. And I thought I might just turn to you, Peter, as chair, to perhaps give some reflections on how to align the important concerns about the clear gaps and deficiencies in the performance of WHO in response to Ebola and sadly in some other areas as well, with the unique and critical need of an organization like WHO as a coordination hub for response, and the new roles that WHO could potentially be taking on as we try to strengthen the infrastructure for detection, preparedness, and response.
Thanks, Peggy. And Gabriel may want to add to anything I say. To start with, just because the report isn't full of a lot of very detailed analysis of what went wrong and who got things wrong and why did they go wrong doesn't mean we didn't spend quite a lot of time looking at all of that. But as a commission, we decided to look at all of it in the spirit of devising what would be good things to do in the future, rather than rehearsing the same description of all the same things that went wrong. So we made a very deliberate decision to look at all that stuff, but actually to focus the report itself on what should be done in the future. Our view was that in facing a global problem like pandemic, infectious disease crisis, is you need a global coordinating entity. We have one in the WHO. It may not have performed in the way that we wanted it to, so it will need to change, but we see it as playing a leading role in preparedness and response. But if you add up the number of things that we are recommending that should change about the WHO, they are quite a considerable, sort of, in a sense, program of change. I don't know, Gabriel, do you want to add to?
No, I think we'll just...
Okay, we'll just go on.
Quite a few questions, I think.
Okay, the first hand I saw go up was Lori's in the back.
Hi, I'm Lori Garrett from the Council on Foreign Relations, and having worked on one of the other 6 major reports that have come out since January of last year, spawned by the Ebola epidemic, I know how hard you guys worked, and great praise to everybody involved in this effort. And Peggy brought up the key point, where do we go from here? How do we get this ball rolling somehow? So I want to ask you a political realism question. Okay, 4.5 billion. If all of that annually was supposed to be in the WHO budget, that would be an 8-fold increase in the total WHO budget annually. Not going to happen. Now, the current core assessment covering 2016 and 2017 combined, in other words, 2 years, is 929 million. If a miracle occurred, as it has not for the last 40 years requested, and the World Health Assembly actually voted to double its assessment, it would still come a long ways short of having any money to pool on the level that you're calling for. And everybody that works on non-communicable diseases would be infuriated because they would have to skew the entire WHO budget to this singular task to even come close to the monetary target point you've put up. So where is the political reality on this?
Shall I say that?
Why don't you tee that off?
To start with, a very, very small proportion of the 4.5 billion we're suggesting will go anywhere near the WHO. The lion's share of the 4.5 billion, 3.4 of the 4.5 billion, is actually being spent largely by national governments in their own countries. So the biggest chunk we're talking about is, and I don't underestimate how challenging that is going to be, is all around domestic resource mobilization or support through the World Bank, the other multilaterals, and things like the GHRF initiative to upgrading of public health capabilities. And that is absolutely vital, but it's a big sum of money, and we don't underestimate the challenges in that. In terms of the core contributions, we have not been in a position in the time frame to do a detailed analysis of exactly what the Centre for Health Emergencies is going to cost, also because it's going to have to deal with emergencies other than infectious diseases, which were the primary focus of this commission. But the kind of number that has been put out there has been more the number that the interim panel put out, which is a 5% increase, which is 45 to 50 million over a 2-year period, so 25 million-ish a year, which is a very different number. Likewise, the cost of financing the $100 million contingency fund are probably in the order of $25 to $30 million a year, depending on your assumptions of how quickly and often it gets drawn down. These, I think, low tens of millions of dollars of numbers are not unrealistic. Now, I absolutely appreciate the degree of sort of controversy and difficulty around core assessed contributions. The point we are making, though, is if you believe that preparing and responding to infectious diseases is an absolute core function of the WHO, you should fund those functions as a core function of the WHO rather than as a sort of voluntary contribution basis. The $1 billion for R&D is, again, I think we need to be clear, the PPDC, the Pandemic Product Development Committee, although it is under the umbrella of the WHO, is not a WHO entity. It is a committee formed of leading R&D experts from around the world and they'll get secretarial support from the PPDC, from the WHO, but are independent of it. This money does not go directly to the WHO. So we're not talking about the WHO getting a kind of a very significant slug of this $4.5 billion. Most of the $4.5 billion is going through countries or through the R&D. There is some resourcing, though, that needs to go to the WHO itself. No, we're saying the starting point for upgrading public health capabilities has to be domestic financial fiscal resources. Now, that's not going to be possible in all countries, but in some countries, there is frankly a question of domestic prioritization, is how important the governments decide that protecting their people through better public health is, and how prepared they are to allocate budget resources to that. And that is, I think, where the notion of having regular, objective, and published assessments of public capabilities is really important, because that's where civil society can hold. Oh, sorry, can people not hear me? Just a little garbled. It should be better now. Okay, I hope the garbled notion was the mic and not me. But that's where the notion of having these objective assessments, I think, is extremely, and we think as a commission, is extremely important.
Okay, now I'm just going to point at people. I apologize, I don't know all your names, but if you could identify yourself with your name and your affiliation, that would be great. The man with the orange tie.
Thank you. I want to add to Laura's congratulations. There have been many analyses and all, but this one has hit the four big levers in terms of governance, systems, innovation, and money. So thank you for that. I'm John O'Quick with Management Sciences for Health, and also the No More Epidemics campaign, which was launched in South Africa at the Mandela Center to have a civil society, public-private group ringing the bell, just as people have said needs to be done. You can look it up on nomoreepidemics.org. So an offer and a question. The offer is to use that platform to help get these messages out. The question is on investment. I mean, epidemics, pandemics, the cumulative cost of what's out there now is already about $100 billion a year. The indirect economic costs plus all the direct healthcare costs. Ebola, $10 billion got added to that. $5 billion for emergency, $4 billion for rebuilding, and $1 billion for research and development. Was by 50 different funders. Was that the right amount? And so two questions. One question is $4.5 billion enough in the sense that if we're talking about pandemic preparedness, yes. If we're talking about pandemic prevention and we bring in some of those economic assessments, then that doubles it. It's still $1 per person per year for everyone on the globe, which is not a bad buy. So one investment question is actually, is this targeting enough? The other is that in terms of who pays, that $60 billion is a hit on the private sector, on the economies and all. And I guess in whose interest is it? And Lori and I had an interesting conversation in her office about in whose interest is it to keep these epidemics from happening. And I think there's more resources out there to be mobilized if we can make the case.
Well, I guess money always matters, so we're coming back to you, Peter, in terms of the finance questions. But I think, this is clearly a moment when there is more attention focused than ever before on not just the costs of putting these kinds of programs and activities in place, but also the costs of not doing so.
Absolutely. On the specific question, is $4.5 billion enough? $4.5 billion would make a huge difference. I think if we get the 4.5 billion, we can then worry about whether or not we need more. But 4.5 billion would make an enormous difference to both preventing and preparing for potential pandemics. Your point about the private sector is a good point. There are a number of points in the report where we're suggesting potential ways of sourcing funds from the private sector. By the nature of public health, it tends to be a public good, but it is an area in which the private sector can make contributions to increasing the resilience of societies.
Thank you. Let's see, Stephen. Microphone.
Thank you. Steve Morrison from CSIS, and congratulations on the report. It's quite wonderful to read through. Two questions. One, on money, you imply in the report that you're expecting the World Bank to play a lead role in financing national capacities in low-income and middle-income countries which don't have the budgets to cover this. And this effort was very closely undertaken with the World Bank. So could you elaborate on that assumption? Because when you ask, like, where is the money going to come from, that's implied in your report. And if you could be more explicit about what your expectations are of the bank, it would be helpful. The second point on money is the U.S. government, through the Ebola emergency funding, brought forward $1 billion in capacity building, the single biggest lump sum of money dedicated to this purpose, but it's short-term money, and it will run out as we're transitioning into the next administration. I think it'd be very, very valuable for this group to really put a singular focus on that issue looking ahead, if money, as you pointed out, is so vitally important. On the political strategy, I didn't really hear what your political strategy is, other than to say the G7, the G20, and the UN should get active. Who are you targeting at the political leadership level to carry this? Are you looking at Abe? Are you looking at the Chinese for the G20? Who is it that's going to really carry this? What's the core nucleus of high-level political leaders who are going to make this happen? Because across any of these reports, if that element is not there, they're just going to be on the shelf. Thank you.
Thank you. Well, very important set of questions, and I'm afraid, Peter, the response goes to you again as well.
Okay. First, on your question about money and the role of the World Bank. What we're saying is that we think the World Bank will play a role as a lender and supporter, and indeed we understand the World Bank is prepared to do that, but we also think it should play a coordinating role because there are many other entities, be they the regional development banks like the African Development Bank or Asian Development Bank, but also the new players on the block, the BRICS Bank, the Asia Infrastructure Investment Bank, and so on, and the bilateral partners such as the United States through the GHSA or the UK through DFID and so on. And what we see the World Bank as playing a particular role in doing is ensuring effective prioritization and coordination among the international donor partners so that they're not all, in a sense, rushing after the same country, but making sure that between them we are supporting the countries that are most vulnerable and most need help in improving their public health capabilities. And I think we have to recognize, those of us who live in advanced economies, that although there is an altruistic case for doing this, in this particular instance, there is also a self-protection case for doing this. The point's been made, pandemics do not respect national boundaries, and the economic disruption moves even faster than the cost to human lives. And so I think there is a very strong case for at the both bilateral and multilateral level for doing this. But this is also where the having an objective, rigorous, transparent assessment mechanism is really helpful, because it makes very clear where the gaps are that need to be rectified, and it also means that donor partners can, in a sense, contract with local governments about, okay, so what is going to be done, and what's going to be measured to actually make a difference to this set of public health capabilities. Your point about sustainability is absolutely critical, which is that we think that in these discussions there has to be an ongoing discussion about pathways to domestic sustainability, domestic resource sustainability, because in the long run, trying to fund public health systems through international aid is always going to be somewhat subject to the vagaries and whims of budget discussions in other governments. And that's why it does tie into a lot of efforts that the World Bank and others are involved in around local resource mobilization, local tax collection systems, and so on, because it has to be sustained. Otherwise, what we don't want is building infrastructure that then doesn't have the ongoing funding to have the right trained people in it. In terms of the political strategy, it's a good question, and there are many people in this room who I think can actually play an important role here, because I don't think it's a single point political strategy. I think what we have to do is persuade a number of different leaders and political constituencies that actually this is not a time to say, oh yes, another set of worthy reports, people will lose interest after a while, and we'll move on to the next thing. But this is a time to actually take action. And I think it's really important that we don't just take, in a sense, symbolic action, but that we take actions that make a lasting difference. And that's why we have put so much emphasis on the public health infrastructure at a national level. Fixing that is hard work. It means training people. It means setting up systems that work not just in the capitals but at local levels and so on. It's not the sort of most glamorous thing necessarily, but that is probably the single most important thing. And that is not just going to be the big global leaders that determine that. It is going to be political leaders within individual countries. And individual countries have demonstrated that they're capable. There are relatively poor, I cited Uganda, relatively less resourced countries that have shown that they can do that. And we need not just to name and shame, but we also need to recognize and celebrate those that actually do make a difference.
I'm going to turn now to a question from the webcast. I also want to encourage you, as we move towards the end of our Q&A session, to also take advantage of our other experts and commissioners here who come from literally all around the world. So,
Yes, this next question might be appropriate for Gabriel. It's from Ricardo Milan at Hopkins. And he asks, what are the main incentives we should offer to countries that report diseases in a timely manner?
So if I understand that the question is, what incentives can we offer countries to report on a timely basis? Yes. If you sort of take a close read of the report, it basically says, look, the first line of defense should be at the national and the subnational system level. And it does call for regular, routine reporting. And the whole gist of the spirit of that is, I think the key word is normalizing this reporting, that it's no longer seen as an all or none phenomenon. It shouldn't be seen as a huge deal. It's okay to overcall. We would rather err on the side of caution. Very first principle of public health is to make sure that you don't miss anything, especially when it has got pandemic potential. So that's the sort of the spirit of it, where you normalize this reporting. And we call for this at both the national level as well as at the global level, that from this new center at the WHO, that there is transparency, not only to national focal points of all the member states, but also to the public. And the initial sort of hesitation that the Commission had around the table was, well, will this raise too much of an alarm? It may in the initial stages, but when you keep on doing it week after week after week, it would just become a normal routine, a normal process, so people will get used to it. And in terms of incentives, you will see that on, I think, one of my slides, that there are 4 different levels. So there are going to be monies, new monies, that will support the work of the center in normalizing this reporting, but there will also be facilities, both coordinated by the World Bank and supported by the regional banks and other donor agencies, but also for the IMF to try and make it easier for national governments to report and then to access financing facilities that would give them the tools to respond, but also to deal with the necessarily adverse economic consequences of reporting. And that's really where the sort of 4th layer, where the IMF comes in. And so hopefully it would be enough to make the new system, the new risk framework, work better than what it has been doing in the past.
Thank you. Other questions from the web, or should we return to the room? Okay, right here.
Yes, thank you. Thank you each for the fine report. I've heard very little.
Oh, here's a microphone. Also, can you just say your name and affiliation also?
For Marilyn DeLuca, Board of Directors, InterHealth International. I've heard very little this morning specifically on health workforce, and I know you've talked about public health infrastructure and health system strengthening. Before, during, and after the Ebola crisis, we had huge issues and concerns about public health shortages in terms of talent, but also direct health workers. Indeed, in this country, and just in our preparedness, most of the health centers that worried and worked, they put great demands on nursing services, on training, education, et cetera. There's an opportunity here, I think, and I'm curious to hear your reaction in terms of linking this report and your recommendation in terms of national spending on public health strengthening to the global strategy on human resources for health for 2030. It seems that we would be very wise to do that in terms of giving both efforts really a lot of political strength and energy. Interested in your comments, particularly perhaps Dr. Leong.
Right. Can't agree with you more. The hardware is there, the institutional framework is there, but ultimately it comes down to people. Where are you going to get the people who would be your national health system, your subnational health system? A lot of the things that Irene so passionately talked about comes down to who do you have in the field? And I suppose that's where Peter's 3.4 billion comes from and will be paying for. It's largely people. So you do need that huge injection of new resources, specifically really to train up that generation of people in national health systems and in the field where they are currently under-resourced and, quite frankly, in some parts of the world, non-existent. So I think that's really where most of the effort is going to come from. And just let me remind you that the 3.4 billion, a lot of that, the great majority of that, is going to go into training up the epidemiologists, the lab workers, and the field workers, not only just in wartime, but in peacetime. And in fact, most of it is going to be in peacetime. And it's not an endowment, it's not a one-off fund, it is an annual incremental spend. And so I think that really is the crux of the matter.
Thank you. I think your last point is enormously important to remember about the routine benefits to medical care and public health practice, as well as the ability to be able to respond. I also want to, if I can, extend your question to Maria to talk about the importance of workforce to undertake the R&D, because I think one of the things that was a clear gap in the Ebola response was the ability to actually begin to, on the ground, implement some of the important studies that needed to be done to begin to give us the answers needed to prevent, treat, and mitigate the outbreak.
Yes, can you hear me? Thank you, Peggy. Indeed, this was we had a great discussion in the R&D group precisely about this issue. One of the key tragedies, of course, in the case of the Ebola situation is without the proper protective equipment, the first line responders were some of the biggest casualties we had. So it was very, very clear that we need to give tools that are fit for purpose. So not only the training of the people, but the ability to deploy scientists in the field to be able to do research, to be out of the way of the people who are trying to take care of the patients, but at the same time doing the research that is necessary in order for us to be able to figure out whether a vaccine might be working or whether a therapeutic might be working. So indeed, this is something that was extremely important and correlates to something that I think we need to ensure is that when we do have the technologies, that they are able to be deployed in the field and are appropriate for the use in the field. So it's a two-layer strategy. It's not only the people, but it's the tools that are there for the people to be able to use in situ, and the ability to conduct research and to have the scientists go in there and do the science that needs to be done in order to ensure that we have the next generation of tools.
And to really make sure we have the infrastructure
There
in
to
place
do it.
in peacetime as well
And
as in wartime for
correct.
doing some of this important
So we
work.
couldn't agree with you more.
Let's see over here. And the microphone.
Good afternoon. I'm Bruce Aylward. I've got the perhaps dubious distinction of being the executive director ad interim of the new WHO program on outbreaks and emergencies. The first thing I want to do is acknowledge and thank the Commission for the absolutely outstanding work and report. I think, as many of you are already aware, it aligns a great deal with and has influenced the vision of where the Director General is going in her thinking of this new program and the vision that she'll lay out at the end of this month to the Executive Board. Perhaps a comment and then a question to Peter. I'm quite happy for any of the members to speak to it. But it was on the issue of what failed in the Ebola response. And I think what really failed was when you use a technical specialized agency, which is a federated structure and politically elected leadership across 6-7 different centers to run an operation, that is what fails. And I think that one's got to be very clear: is an institution failed, or is it a structure that was set up for one purpose asked to do another? If you push a penguin off a cliff, we know it doesn't fly. And in fact, that was probably what the experiment was most analogous to. And that brings me to my question a little bit to Peter. I think you used magnificent language in assuring Lori of how little of the new investment would go into WHO. I think that leads me to think, okay, this bird is going to have very, very small wings. We've asked a car to fly, basically, to be an airplane in the Ebola response. And eventually, I think the organization got there, put over 1,000 people across 70 sites, many of them with no infrastructure to be able to operate. But as we go forward, I think we're really at risk with the language. And even I wonder a little bit about the analytics in the report that says $50 million additional spend in WHO gets you from what you are today to an operational agency with this kind of a mandate. Because when you benchmark this organization against other agencies operating in food or other things, it's right now at 1/10 the manpower, less than a quarter of the expenditure of those. So I just wonder the analytics that went into that and whether or not you really feel comfortable that kind of an incremental spend achieves what you describe in, I think, 25 pages. Not sure.
Well, first of all, you've got a very important job. Of course. And the spirit of the report is to, if anything, reinforce what the WHO and build on and strengthen what the WHO has already embarked on in terms of creating the program. We want it to be a center, not a program. We want it to have an independent board to give it a degree of political installation, and we do want it to be adequately resourced. Actually, if you read the report closely, we are not pretending that we did a detailed analysis of what resources you required. Because for the Senate has roles beyond infectious diseases, responding to bioterrorism and other things. We did not look at what those resources required. We were not in a position to know how much could be redeployed from existing entities within the WHO. So to enable us to come up with an aggregate figure, we simply used the number that the interim panel suggested last year, and we absolutely accept the limitations of that. However, it doesn't change the basic message, because if we've got it wrong by a few tens of millions, that's really important in terms of the funding and resourcing of the centre. We completely accept that. It's not going to change the big picture, which is the big slug of money is around the upgrading of public health capabilities at a national level. There's a very important sum of money, and as I say, we don't pretend we've been very precise about that at all, that needs to be dedicated to funding the centre. The other important point that I'd come back to is we think that funding needs to be committed. That it shouldn't be voluntary in nature, because otherwise you're constantly going to be worrying about the sort of sustainability of the programs that you're running.
Well, thank you. I see that we have come to the end of our time. There's so much richness in this report, so many findings and recommendations, and importantly, I think, the laying out of a framework to identify the critical elements necessary to pursue if we are going to make a sustained and meaningful difference in preparedness and ability to respond, and hopefully to prevent future crises such as the one we just experienced with Ebola. As Lori and others have noted, this is also just one report of many other reports that have looked at different important components of this challenge, and there's a great deal of work in front of us to really make sure that the best of these findings and recommendations are fully reviewed and clarified and discussed amongst this group and many others, that there's an effort to synthesize the perspectives and findings and recommendations from these various reports, and importantly, that we really work together to support the ongoing political will and commitment necessary to make an enduring difference, to really make sure that the public and policymaker understanding of the critical nature, cross-cutting nature of these issues is not just a fleeting headline, but an enduring understanding, and really becomes increasingly a part of how we think about global security, so that this is no longer the neglected dimension, but an essential element of how we think about and address some of the most pressing threats to life on Earth now and in the future. So really appreciate everyone taking the time to be here today. Appreciate so much the work of the commissioners and the many layers of oversight and leadership that made this report possible, and importantly, the staff that worked on it. I want to again thank our hosts, the Rockefeller Foundation and Dr. Judith Roden, for making this possible. And I understand there's a reception now, so that some of you who didn't get the chance to ask your questions can do so, and certainly there will be much ongoing discussion of these issues and concerns as we step by step make progress towards a safer world. Thank you very much.